So we are live, I believe, Heath. So let's get started. Just give one more second to make sure we are indeed live. I always get a little confused. Here we go. Welcome. So as entrepreneurs, we need optimal health and especially we need optimal brain health, mental health. We talk about focus, mood, creativity. These are absolutely critical when we want to have a successful but also a sustainable business and lead our team and help our clients. One of the most common reasons actually for factors that can affect and impact our focus, our drive, our ultimate mental and brain health are actually not the foods that we eat and not our mindset, but actually underlying medical conditions that we need to be aware of. Sometimes we know about them. Sometimes there's silent killers that we're going to be talking about today. And indeed, we still have the chance of preventing many of these. And the condition we're going to be talking about today is very conducive. Obviously, there's different types. There's type 1, type 2, and we'll talk about it in a moment. But there are complexities involved. However, diabetes, which is what the focus of today is very manageable and actually can be controlled very nicely with lifestyle measures. So, it's really important that not only do we treat and manage, but we identify and even prevent these conditions when we can. Welcome, I'm Behbods. I'm a public health preventive medicine doctor here in the UK, and I'm on day 14 of this marathon of a 90-day challenge where 2 weeks ago, I told myself, I need to sort myself out. Now that we're hopefully coming out of the pandemic, I've lost a lot of my health, and I just want to share my journey of regaining my health and along the way, teach my insights in terms of what I know and what I can share with you in the world of health, but also help those of you who might be deciding to pivot as entrepreneurs to tackle some health issues given perhaps personal lived experience. So if you'd like to learn more, check out the link in the description below where there's some free resources that will guide you in that path. But, just to say, my coach for health and wellness is Ed Jaffa, and he's been talking about losing weight. Just yesterday, he told me, just switch your plate size. So I'm going from a big plate size to a smaller plate size and trying to walk again. I've been walking hours, but the blisters have killed me. Disclaimer, I need to put this out there. Anything you hear today is for information and education only. Do speak with a licensed doctor in your area if you're concerned about your health and well-being by any means. So just a quick recap before I introduce my special guest today. When it comes to health and well-being overall, but especially brain and mental health, I'm talking about 4 stages or 4 pillars. So the first one, which we've covered over the past week or two, has been the foundation, which is all about mindset and those things that contribute to our mindset. So do check those videos out, including some guest speakers. This week, we're going to be focusing on the architecture, which is all about nutrition, diet, supplements, even nootropics, smart drugs, and even psychedelics. So we'll talk about that over the course of the next few days. And we'll be following on with the other 2 stages in due course, but we'll come on to that later. Look, I'm a student too, even though I am a doctor and I've been training for the last 20 years and I've got a lot to share. I love to hear from you. And that's why my special guest today is Heath Stone. He's the founder of the Uncommon Diabetic Solution based in a gorgeous place, let's just put it that way, that I'm very envious of. He's based in Vancouver, Canada. Heath, welcome to the show.
Thank you, Behbods, for having me on today. I'm really excited about the opportunity.
Likewise. Look, you're an absolute star. We've just been having a chat before going live today. I really appreciate you joining me. I'd love to hear about your backstory because for those of you who are watching or listening, do listen carefully because I want to elaborate why this means so much to me. So Heath, tell us all about you.
Well, everyone's writing a story and our journey is really what life's all about. This being on health and about diabetes and my diabetic story and how it relates to our 4 pillars, which you have as well, for health. I was a police officer when I was a young man and worked in Vancouver. And I had a medical procedure. And that medical procedure, along with probably the stress of the lifestyle, triggered an autoimmune response. That autoimmune response decided to choose the islet cells in my pancreas, and they killed it all. And now I woke up after a very extreme introduction to diabetes. I lost 40 pounds in a month, had all the symptoms. And these are things that you should be aware of. Drinking an immense amount of fluids, and at the time, not the right ones. I was fatigued beyond fatigue. My vision was blurring. I was losing weight rapidly, even though I was still eating an immense amount. And the list goes on. Over 4 weeks, I lost 40 pounds. I eventually went blind. I went into a coma.
Wow.
I woke up in hospital and was basically told, Heath, welcome to type 1 diabetes. So that transformed my life. And all of a sudden, I had lots of people and doctors telling me, well, you can't do this anymore, Heath. You can't do that. That's too extreme. And all these different things, because I was involved in a lot of extreme sports back then.
Look, Heath,
from that,
keep going. No, keep going. I thought you were pausing for a moment. Carry on. All ears.
Yeah. I'll just finish this one segment. And then with regards to the policing, the shift work, the poor unscheduled eating habits, the sleep deprivation, the inability to actually have a routine in life because of the shift work. And the department treated me amazing, but I made a choice for my health that I would change. And that's what got me into entrepreneurialism and business. And I have some very close friends that really were motivational to me and helped me and transformed me and saying, Heath, you've got a lot of abilities and it's time to step forward into the business segment. So that was my transition and introduction to diabetes and taking control of my life personally through realizing that my job didn't have to control me, that I could change and create a lifestyle that was my own. That was the first step to my transformation, and changing my life from a common diabetic life of all these I can'ts, I don'ts and won'ts and don'ts and etc. to, hey, I can, I will, and I must take control of my health personally. I think that just to conclude sort of that story, it's been a 27 plus year journey of living with diabetes. And I have done a lot of things wrong. I have tried a lot of different things, but every failure is a fantastic adventure in learning. And I persisted and I learned and I continue to grow so that I could give myself the chance to get this uncommon diabetic life. And that's really what I want to share through my Uncommon Diabetic Solutions programs is the 4 pillars of diabetic health.
So I'm a bit curious and you went from being a police officer. Obviously, you were diagnosed at a young age with type 1 diabetes. You went into becoming an entrepreneur, hopefully to take control of your own life and your work schedule. So I've got 2 follow-up questions, if I may. First of all, how was that? I mean, being an entrepreneur is not always that easy. So did that give you the freedom that you were looking for?
Well, definitely going into business for yourself is full of challenge. And those challenges definitely, in my mind, are worth it, right? Because the ability to be able to choose the lifestyle that you want, the type of business that you go into, that's true freedom, the ability to choose. So I was able to begin putting routine into my life. I started to change my sleep patterns, the ability to recover properly. I then began to obviously change diet, nutrition, as you just said, is a really key pillar. My exercise began to become regular again. And ultimately, I just chose to say, if it's going to be, it's up to me. And no matter what our doctors say, our doctors and our specialists are extremely important, but they're not living with it. So you need to take all of that information, treat it seriously because they're there to help us, but also realize that my diabetes is unique to Heath Stone. It's not the same as John or Sue or whoever you are in living with this condition. You have to realize that there are principles that are applied. And then those principles, as we learn to use them, need to be personalized to each one of us.
Couldn't agree with you more. I mean, when I was training as a junior doctor, as a medical student too, I remember sitting in a clinic, a family doctor, before the next patient came in, just said, look, this next patient walking in has type 2, not type 1, type 2 diabetes, so late onset diabetes. And just listen to his story because he's the expert, not you or me. It's the patient that knows everything about their personal lifestyle and circumstances. And so you have to work with that to help them. But I'm now curious for my follow-up two question, which was, okay, so you went through this 27-year journey. You took control over your work schedule, life schedule, but why the pivot into doing business in the world of health and tackling diabetes head on?
Well, a really good friend of mine was the first person that said I should go this way. His name is Dr. Sean Richardson. He has his PhD in energy, health, and performance, and unbelievable friend. And he really supported me and said, Heath, all of the skills that you've learned through business and your diabetes, you have everything it takes to be going out and empowering people to transform their lives from common to an uncommon diabetic life. And he is the one that actually said, you need to do this. People need to hear your story and the expertise that you have in it, the routines that you've created. And you can help people create a map that will help them transform their health and diabetes from common to uncommon. And it's really based around these 4 pillars of diabetic health. The first pillar being our mindset and intention, same as yours. How we think is critical about ourselves, about our condition, about our food. That leads to the second pillar, is our hydration and nutrition. What are we putting in? How are we fueling our body? Are we using fast food? Are we choosing the high carbs? Are we drinking lots of pop? Or are we choosing to actually drink more water, choose whole foods, etc.? Our exercise and movement. Well, I come from being an extreme athlete to being told, well, that stuff's too hard to manage your blood sugars. You just need to walk. Remember when my endocrinologist said, golf, you need to try golf. And I looked at him and went, what? That's not a sport. Well, now I'm a golfaholic, and it is an unbelievable sport for health, right? In that area. And it's finding a passion that keeps you moving and exercising. It's to help manage your sugars, and it's a critical pillar. And then the last pillar that we all forget, and probably the one that I have had the biggest challenge with, is rest and recovery. Coming from a policeman and into entrepreneurialism, sleep is a luxury. I used to have a saying of, I'll get enough sleep when I'm dead. And how foolish I was. Now I'm always shooting to get a 7 to 9 hour area. I've never hit 9. My goal is to be consistently around 7. But that's again individual. But that's the only time our body heals, is during that rest and recovery. So those are the 4 pillars of diabetic health that we're really trying to help people better manage and understand. We can create uncommon results as long as we identify those reasons and then the routines that will drive those results in these 4 pillars.
I love it. And we're going to dig deeper into maybe 1 or 2 of these topics with you in a second. The reason I'd love to hear that story of yours is because, as a medic, I teach. The word doctor actually means teacher in Latin. And I love working with students who, for various reasons, me included, we went into health because of an issue that we felt as a child growing up, that we want to help people with their health issues.
Yes.
But what I've been finding over the course of the years is more and more entrepreneurs who, like yourself, they go through a lived experience of their own. They have a health condition of their own, or perhaps care for someone. And indeed, the past 12 months of the pandemic, you don't even need to have had a condition of your own. We've all lived through this major issue of COVID-19, and you may have seen opportunities that you want to tackle. And next on the horizon are, environmental issues, climate change, and all these kinds of problems. Now, all of these combined, you as the entrepreneur, Heath, and you at home or work listening to this, you've got the skills and the knowledge that the health sector may not have. So we need to team up. You need to bring your entrepreneurial mindset and thinking and problem-solving attitude and team up so that you can actually help us think outside the box and bring innovative solutions to the market. So I'm here. I'd love to team up with you. Do check out this website and the link in the description below. I'm ready to team up with you. So back to you, Heath. Would you be able to just teach maybe one or two tangible tips that I can take away as part of my 90-day challenge, but also our audience can implement straight away?
Yeah, so at Uncommon Diabetic Solutions, we're really focused on empowering people and organizations living with and impacted by diabetes. Really, why are we doing that? To help them create the energy, the health, and the performance that they desire. The 4 pillars of health and how we manage them are really critical to the result that we do. And it all comes back to our routines. The best way to change our routines, which will create our habits inevitably, because what we do repetitively creates the skills that we have in that area, is to change one thing, just one. We don't have to go through and change everything at one time. You don't try to jump to the top of the stairs and go, no, you do them one at a time, or some of us try to do 2 or 3. But the real truth is it's small steps consistently that will bring the transformation. So the very first thing that I always think about is, what am I doing consistently that is harming me? And what am I doing well that's going to empower me? So the biggest thing that I've basically touched on briefly was my sleep. It's pillar 4, but it's going to affect all of them. And the reason I'm saying that is it's a simple thing for us to change. With COVID, most people are in the pattern now of watching far more TV than they're used to. Probably staying up a little later because they're not having the demand on them to get up as early. But the truth is that if you just go to bed at 10 and you get your 7 hours of sleep, well, you're at 5. So if you sleep till 7, you've got 9. Get up and do something that moves your body. Spend time reading a book. As we wake up in the morning, our theta waves, we're more prone to remember. We're going to have a better response to it by putting in good content in the morning. We're working on that mindset and that intention for the day. And then lastly, drink some water. So I've listed one thing in each of the 4 pillars there, but it's just really start with one. And if that's getting up and drinking a glass of water, you've made a step forward to it. And what we're going to do, Beirut, and we've talked about this before, is we're going to actually offer everybody to have that opportunity to participate in creating the foundations through the 4 pillars of diabetic health. And we're going to offer a free program, a 6-session program that we're going to do, and with your support and collaboration, offer everybody that opportunity to go through the 4 pillars of health and create a map, that massive action plan, which will address and assess where we are each are now in the 4 pillars. And then what is the plan of action to move forward to transform those habits that will drive the routines and the results that we desire in our life. That could be just losing weight. It could be for an elite athlete, improving their performance. But these habits and routines we create will drive the results that we desire to transform our life.
I love it. I love it. Heath, I'm looking forward to joining you on this 6 weeks? Yeah, 6 sessions over 6 weeks? Or
yep, we'll do 6 sessions. May 15th, we'll open up registration for the event. And June 1st, we'll start. And Excellent. Then there'll be 6 sessions after that that will go through the 4 pillars of health. We'll do assessments of where we are now. We'll help create a plan, what I call a map, for transforming your life and helping you set those goals and outcomes that you're wanting, really digging into the reasons why you want them, and then what actions and routines are required to achieve them.
Let me add to that, Heath. For anyone watching or listening, don't feel like this course, from just listening to Heath now, and I'm a student today, I'm learning from Heath, and just hearing describe those 4 pillars, I'm glad at least 3 of them we're in the same consecutive order. It's the fourth one that we went, slightly tangential. Yours was sleep, which is incorporated in my engineering phase. But in terms of the fourth pillar for what I'm going to be covering in the next few weeks, and definitely not as much detail as you will be going through, will be the ventilation system of our building, and that's the environment, our homes and cities that we live in, and how toxins and various other factors can impact our health. But what I want to add, Heath, for the audience is that don't feel like you just need to join Heath's course, the free 6 series, if you are known to be diabetic. The principles there can help with preventing any lifestyle related condition. They can just improve your health and well-being overall and put you in good stead for hopefully putting you at less risk of any health outcome, in all honesty, from heart disease to cancer. So I'm not putting medical terminology to this, but all I'm saying is the principles are there. And there's one silent killer, isn't there, Heath? Do you want to tell us about that?
Well, ultimately, if all of us, and the 3 types of diabetes, type 1, which I am, is insulin dependent, and I'm on a pump myself, and it has to be regulated with some form of an injection of insulin. Type 2 is basically all of those people that are, in most cases, I want to say a lifestyle change could rectify it, because it's a degenerative condition. So therefore, that means we can regenerate it. And the third, which we like to, is you and I are coining the silent killer, is type 3, which is the insulin resistance. And insulin resistance is something that is a true, and you maybe want to elaborate on this more as a doctor, in the science behind it, it's a true killer because it's the number one cause to most dementias. It's over 70% of all cases of dementia and Alzheimer's are directly related to insulin resistance. A stat that just came out by CDC with regards to COVID, over 78% of all hospitalizations and deaths are directly related to obesity, diabetes, and the factors associated with diabetes.
Yeah.
It's something that we seriously, and to understand that what we do with our thinking, our eating, our exercise, and our rest are critical to transforming our life. And we can all do it with a snap. It's just a choice.
Yeah, absolutely. And now, what better time to do this now? So I think what you were referring to, type 1 is that early onset diabetes where young people typically get it. And it's typically your immune system, it's an autoimmune condition, which can be caused by a number of things. Type 2 is the one that occurs later in life, but we're actually seeing younger people develop type 2 diabetes. And that's often associated with risk factors like obesity. And it's, related to insulin resistance and all sorts of other things. But the type 3, which I believe you're referring to, of course, there is one linked to brain health. But the other one that I wanted you to touch on, which is what we were discussing before, is the silent killer in terms of pre-diabetes. So many people don't even know that they've got glucose intolerance, and so resistance, even insulin resistance. And this is a silent killer. It's associated with fatty liver disease, non-alcoholic fatty liver disease. All of these we'll cover later on, but essentially do check your blood glucose levels. Do go and get a checkup, get your HbA1c levels checked, which Heath will talk in much detail, I'm sure, in his course. Look, I just wanted to come back to Heath with any final words, but don't take this lightly. Your health and well-being is absolutely critical, and actually perhaps 80% of the success of your business as an entrepreneur is your health and well-being. So Heath, any final words?
I really am grateful for the opportunity of being here today to talk about these things. And I look forward to us, as we've discussed, talking in further depth about health and just, our mind, our body, and our soul. And how do we help bring health in all these areas? Uncommon Diabetic Solutions, can be found at uncommondiabetic.com, is really about empowering people really to live their ideal form of life, or an uncommon diabetic life that's fully empowered and fully able to achieve anything that you set your mind on and focus at. And we have many different options for people to learn. We have what's called the Uncommon Diabetic Challenge, and that's an opportunity for people to go through a 3-month program, and it'll help them do a self-assessment on the 4 pillars and help create their map. And that's self-directed. And we offer 30 days over 12 weeks to help do and begin that transformation with a personal training online training program. This can be done from anywhere in your home, and that's free. Just go to uncommondiabetic.com and register for it. The program we're talking about is a live program. It will have me live in a webinar. We'll have guests such as yourself involved to actually dig deeper and go into the 4 pillars of diabetic health to really help provide the education, training, and mentorship on how to transform your life, to help you reach those goals, whether it be just to lose some weight, to get better meal ideas and habits in place. There's so many things I could talk about. I get a little bit, I'm so passionate about this, but really it's just about helping you create a map for your life so that you can seize the health that you want, because health is a crown that only the sick can see. With pre-diabetes, it's something that you need to be cautious of. Diabetes is not a crown that you want to wear, especially when you have a choice to take control of the routines and the habits of your life, just one at a time, that will really regenerate your health. And that's my encouragement to all of you, whether it be with Dr. Behbods here and the programs that he's offering, whether it be at uncommondiabetic.com. Talk to your doctors, find people that will help you to learn the lessons on how to take control of your health so that you can have that uncommon life that you desire.
Love it. Heath, it's a real pleasure, absolute pleasure to get to know you before this live call. And I hope the viewers at home or at work listening and watching to this, have found it just as much of value. Do put your questions in the comments below. I have put a link into Heath's website, theuncommondiabetic.com. Feel free to reach out to Heath directly through there as well. Look, tomorrow we'll be diving deep into nutrition. So do join us, hopefully same time tomorrow. And it's been an absolute pleasure. Heath, thank you so much.
Thank you very much, Behbods, and I wish you all the best.